Thank you very much for the introduction, Dr. Yeo. Today I would like to present on the latest technology updates of the Sonalleve MR system and specifically on version 3.7, which was released in November 2020. Sonalleve is a flexible platform for precise and incision-free thermal ablation of, for example, uterine fibroids. It combines two core technologies. On the one hand, magnetic resonance guidance, and on the other hand, high-intensity focused ultrasound. MRI is used both for treatment planning and monitoring in Sonalleve. During the planning, high-resolution MR images with an excellence of tissue contrast are acquired. These images can then be used to accurately plan the heat delivery to the target while sparing sensitive, healthy tissue. During the actual treatment, the temperature at and away from the target is measured with MR thermometry in real time. In addition to treatment monitoring, the temperature information can be fed back to the software for optimized heating performance. The heating source in Sonalleve is a high-intensity focused ultrasound transducer, which consists of 256 ultrasound elements that can be separately controlled. This enables accurate deposition of acoustic energy at the target while maintaining a low energy exposure outside the target. The natural focus size of the HIFO transducer is only about 2 × 2 × 10 mm, but larger target volumes can also be uniformly heated using the Sonalleve volumetric heating technology. In a typical Sonalleve fibroid treatment, for example, the patient would be in prone position on the Sonalleve table with the fibroid approximately located above the HIFO transducer. The table would then be pushed into the MR scanner to start the treatment planning. This is illustrated by the sketch on the left. After acquisition of the planning images, the user defines where the ablation should take place. This is done by placing so-called cells. Cells are predefined target volumes that have an ellipsoidal shape as depicted on the right. The top row illustrates the cross-section of the different cells in the sagittal or axial view. However, the cells are actually defined and named by the diameter of their cross-section in the coronal view, as shown below. The available cell diameters in the uterine application are 4, 8, 12, 14, and 16 millimeters. After positioning the cells, the user then must choose the acoustic power to heat the cell. Apart from the cell size, the user can also choose between regular or feedback cells. Regular cells have a single fixed sonication duration. Feedback cells, on the other hand, use the measured temperature data, and the sonication is automatically stopped when the target temperature or thermal dose is reached within the cell. This short video illustrates the volumetric heating approach that is implemented in Sonalleve. The HIFO transducer is automatically and mechanically moved to the location of the planned cell. During the sonication, electronic deflection of the single transducer elements is applied to uniformly heat the target within the planned cell volume. After the sonication, the transducer is moved to the next planned cell location. Large cells are heated from the center towards the edges to exploit the effect of heat diffusion. If large volumes are treated that require several cells and several sonications, there is a risk for tissue burns at the skin or in the subcutaneous fat layer. In order to minimize the risk of tissue burns in these cases, Sonalleve includes a direct skin cooling or disc system, as depicted on the right. The disc is a circulating cooled water reservoir situated within the acoustic window and in contact with the patient's skin. It functions as a reliable heat sink for skin and subcutaneous structures and therefore reduces the risk of skin burns. The picture on the left shows an actual image of the Sonalleve table. In the center there is the ultrasound transducer in its oil-filled tank. The acoustic window is located above the tank and consists of two ultrasound transparent membranes. The disc circulates the cool water between these two membranes and thus acts as a heat sink for the patient's skin that is in contact with the acoustic membrane. To further reduce the risk of skin burns, Sonalleve also includes a patient adaptive cooling time optimization, which consists of a simulation and the measurement part. Thermal simulations are automatically performed by the software to estimate the cumulative heating in the patient's skin and fat layer over all previous sonications. Given the currently planned cell, the software also simulates the temperature in the skin and fat layer after the next sonication. The software then calculates the recommended and the mandatory cooling time which the user has to wait before the next sonication can be performed. These cooling times correspond to defined temperature limits in the fat and skin layer that should not be surpassed to reduce the risk of tissue burns. In addition to the simulated temperature, Sonalleve also measures the absolute temperature in the subcutaneous fat layer using MR thermometry. This scan is referred to as fat monitoring scan and exploits the fact that the transverse relaxation time T2 of the fat depends on its absolute temperature. Together with the temperature mapping in water-based tissue that relies on the proton resonance frequency shift, this comprises the dual-mode thermometry approach implemented in the Sonalleve technology. The fat monitoring scan is automatically triggered after high-energy sonications, and the measurement is fed into the simulation to both cross-check and strengthen the predictive capability of the model. With that, I would like to conclude this brief overview of the core Sonalleve technologies and features and start focusing on the topic of my talk, namely the latest technology updates. Sonalleve Release 3.7 was strongly motivated and driven by clinical need and feedback, and the updates and modifications fall into two main categories: improved treatment flexibility and reduced treatment duration. Regarding the improved treatment flexibility, previous releases allowed only one single fixed sonication duration for regular cells. This limited the user to a fixed heating time and thus heating approach that might not be optimal for all cases and targets. With Release 3.7, the user can now choose between several sonication durations to adjust the heating approach to the clinical need. Similarly, the acoustic power for sonication was limited to 300 watts in previous releases. However, this was often not sufficient to thermally ablate, for example, deep or highly perfused targets, such as Funaki type 3 fibroids or adenomyosis. Hence, the maximum sonication power for Release 3.7 was increased to 400 watts. Furthermore, treatments of large target volumes have been reported to take up to several hours, with the main contributor not being the actual sonication time, but rather the long mandatory cooling times between sonications. The mandatory cooling times relate to the maximum temperature limit of 48 degrees Celsius imposed on the subcutaneous fat layer. Thus, the maximum fat temperature limit was increased to 50 degrees Celsius in Release 3.7 to shorten the cooling times. Moreover, the efficiency of the disk was improved so that the actual water cooling temperature can now be adjusted down to 15 degrees Celsius. This should yield a further reduction in treatment duration due to decreased cooling times. The higher flexibility in choosing longer sonication durations and higher powers also affected the user interface of the Sonalleve software. On the left, you can see a screenshot from the treatment planning stage in Release 3.7. In this example, the user is planning an 8 mm regular cell at a frequency of 1.2 MHz. The upper horizontal bar shows the sonication power, which now goes up to 400 watts. The central bar, on the other hand, shows the sonication duration. The single fixed sonication duration for an 8 mm regular cell was 20 seconds in previous releases. Now the user can choose between 5 different durations from 20 up to 44 seconds. However, not all sonication powers can be combined with all durations. The product of duration and power gives the energy that is delivered by the sonication, and this has been limited to a maximum of 16.8 kJ. To give additional guidance to the user, the calculated sonication energy is shown in the lower horizontal bar. The increased sonication power and durations can also lead to a higher temperature at the target. Hence, the maximum measured temperature at the target was increased from 80 to 85 degrees Celsius to allow the user to exploit the full potential of these long, high-power sonications without the software automatically aborting them. The implemented changes in the cooling time optimization also affected the user interface. At the bottom of this slide, you can see a screenshot from part of the user interface showing the mandatory cooling after sonication. In previous releases, there was a mandatory cooling time depicted as red waiting bar and the recommended cooling time depicted as an orange waiting bar. Release 3.7, on the other hand, now includes 3 safety levels for cooling times. The mandatory level is still depicted in red, but now corresponds to a higher fat temperature limit of 50 degrees Celsius. This cooling time cannot be overridden, which is indicated by the Disable Sonication button. In contrast to previous releases, the current estimated skin and fat temperature, as well as the estimated temperature after the next sonication, is shown to the user. This additional feedback can support the clinical decision making. After the mandatory cooling time has passed, there is a new, highly recommended safety limit. This corresponds to a maximum of 48 degrees Celsius in the fat layer and thus to the mandatory cooling time from previous releases. The highly recommended limit is depicted with the orange waiting bar, but it can be overridden by the user with a warning for high risk of burn. This is indicated by the orange warning sign on top of the sonication button. The recommended safety limit has not changed from previous releases. It still corresponds to a maximum fat temperature of 46 degrees Celsius. The limit is now shown in yellow and also can be overridden with a warning for excessive heating indicated by the yellow warning sign. The changes to the cooling time optimization have been implemented to give the users more flexibility in shortening the cooling times when additional clinical information or user experience warrants the safety of the faster treatment approach. To further reduce the cooling time, the enhanced skin cooling from the disc can be used. The current disc temperature is now shown to the user, and its target temperature can be adjusted down to 15 degrees Celsius as illustrated in this screenshot of the user interface. To summarize, Sonalleve Release 3.7 addresses the clinical need for more flexibility and faster treatments without compromising the patient's safety. The adjustable and longer sonication durations, as well as the higher sonication powers, enable a flexible treatment approach even for deep and highly perfused targets. Likewise, the 2 overridable safety levels for cooling times give more freedom to the user if additional clinical information is available or clinical experience warrants the safety of the faster heating approach. Similarly, the shorter mandatory cooling times due to the increased fat temperature limit and enhanced skin cooling reduce the overall treatment durations. Hence, Release 3.7 of the Sonalleve platform is a leap towards our objective for providing personalized treatments with flexible decision-making and optimized clinical utilization. Thank you very much for your attention. I'm happy to answer any questions you might have at the QA session at the end.